Hello, today is my 2 weeks post-op and I just want to tell you a little bit about my past 2 weeks, how the healing went. Last time I spoke with you was the day of the surgery, in the morning prior to the surgery and after the surgery. So now after 2 weeks, obviously I am feeling so much better. I don't feel ill at all in any way, and I also don't except for my foot that's hurting. Of course I'm not taking any painkillers. I'm doing much better. So just from the beginning, when I had my surgery 2 weeks ago, the first 24 hours I would say were the toughest. I had pain pretty much all the time. It was not excruciating pain, nothing like that. It just that you are aware that you had a surgery. So that, I think that's normal, that's to be expected, but it's nothing that, I had to cry from pain, nothing like that. Just the awareness. After the 24 hours, I think the first night was a little tough because I think I still had a lot of IV fluids in me, so I had to get up and go to the bathroom more than once, and I couldn't do it by myself. So my poor husband was helping me, and also, I would say I had crutches, and that was a good thing. Doctor told me I wouldn't need them, but honestly, I think it's very good to have them for first maybe 3 days. After that, I felt that I could actually lean on my heel and go to the bathroom like that. But the first 3 days, I really would not put my weight on the crutches, on my, on my foot. It just didn't feel right at all. And I don't know, is it due to all the bandages being really tight on my foot after the surgery, or is it just because my foot being sore? Either or, it just was not comfortable for me. So crutches, I actually, my coworker had crutches and I borrowed them from him, and I used his crutches for 3 days, and that was excellent. As for the pain management, I was prescribed Percocet, and I was taking Percocet that, for the first 24 hours, and it was just really making me drowsy. I really didn't think it was really taking the pain away. Maybe I function differently, or maybe the pain would be much worse if I didn't take them. I don't really know. But I remember one doctor telling me years ago, when I had a much bigger surgery than this, that when it comes to pain, it's okay to take 3 over-the-counter Motrins, and she told me that is equivalent to 1 prescription Motrin, and it's fine. It's not okay to take it all the time, but if you had surgery for a couple of days, it's okay. So I remember her saying that to me, and that's what I did. I actually started taking. I would take 2 Motrins during the day, but then I would take 3 Motrins before I went to sleep. And I have to say that did it for me. It was really great. I slept the whole night. That was my second night. And during the day, I was not taking painkillers constantly, but I would maybe, when I start feeling that the pain is coming back, I would take 2 Motrins, and then I was fine for a good 4-5 hours. And pain-wise, pain is there. You had a surgery, but it's not unmanageable. So I don't think you need to be afraid of it. I'm sure there are much worse things that can happen to people than having this kind of a pain. So just relax. It's fine. After, I would say on the 3rd day in the morning, I stopped taking painkillers. So since the 3rd day, I was not taking any painkillers anymore. 3rd day after surgery, I went to visit my doctor, and he changed the bandages, and I looked at the wound, and everything looked fine. And maybe because now the second set of bandages were not as tight, possibly that helped me, and now I could lean on my heel, and I could go to the bathroom. And so I didn't need my husband anymore, and I could do it by myself. I was really grateful for the fact that my surgery was on Friday. So my husband was home. He took that day off, and he was with me, and then he was with me on Saturday, Sunday. So by Monday I was already doing so much better. That whole first week I pretty much spent in bed. I only went to the bathroom. My bedroom is upstairs, and I don't think I was going downstairs at all. It was just, I was just really being in bed, going to the bathroom, coming back. I was reading, I was writing, I was knitting. I was not bored. I had so many things that I wanted to do, that I prepared knowing that I'm going to be in bed. So it was if it wasn't for the fact that I had surgery, it would be a good time. And then now after 2 weeks, I have to say, yesterday I went to have my stitches taken out. Doctor removed the stitches. I was really worried about that, and it's a little funny because I came to him and I said, "Doctor, I think I would much rather have another cortisone shot than having you remove the stitches. I'm really afraid of the stitches coming out. I don't know why. It just makes me very, afraid." And honestly, it was nothing. It's so silly of me to even think that, because I don't know if I had altogether 10 stitches. I think I felt 2. The rest was nothing at all. And those 2 that I felt, they were more like mosquito bites. Nothing. So don't worry about that. That is really nothing. Comparing to all the pain that I had to have prior to this, all these years of, having this shooting pain going into my toe, taking cortisone shots, this is really nothing, really nothing. So once he removed my stitches yesterday, he put a big band-aid over my wound, and now I don't have the wrap around my foot anymore. And however, I still have to use the walk in this surgical shoe, which I don't think I showed you what it looks like. So this is the shoe that I was given. This is Velcro, and my foot goes in. So I've been walking in this shoe, going to the doctor or around the house when I have to go to the bathroom, because it gives nice support. He said I need to walk in that shoe for another week, and then when I go to see him next week, that's going to be 3 weeks after the surgery, I should bring the widest sneakers that I have, and he wants to see me walk out in those, in regular shoes, and stop wearing these. So this really sexy goth shoe is going away after a week from today. So what else can I tell you that would be useful in your experience through this? I think just positive attitude. It's not the biggest thing. It's actually, I think the surgery is quite small. The problem is that it's on your foot, and your foot, you need it to walk around the house. So that is what makes it difficult in the whole scheme of things. So just having a lot of fruits and a lot of liquids, and a lot of things to read, knit, or any other write, anything like that. But I have to say the time is flying for me. I'm really not bored, and I have plenty of things that I can do. And right now I'm pretty mobile. That the stitches are out, it's so much more comfortable, and so I can walk a little bit. So I'll go. I did put a lot of laundry in. I'll do little things, but not a lot, and then I will sit again or lay in bed again with my foot up. Things that I still can't do, that still hurt, is completely put my foot flat on the ground. I can't do that. I'm still walking a little bit, leaning my foot toward the inside of my foot so that I don't really put a lot of pressure below where the stitches were. It just doesn't feel right. I think my foot is still swollen, so that hurts. I can't really bend my toes when I'm walking, so I'm limping. I obviously have a limp, so you can't expect me to walk a lot. I can go to the doctor's office and back, but I can't really go shopping. And also, I still cannot like twist my ankle, and that I just constantly have an urge to do that, but I can't, because if I do that, I think that I stretch my wound, and then it burns. It doesn't feel right. I also can't completely stretch my leg, because if I do that, again, I think I'm stretching my wound. So those are a couple of things that I still can't do. But other than that, I feel so much better. I'm doing great. And if you're getting ready for surgery like this, don't be worried at all. It's nothing bad at all. I will keep in touch with you again when we get closer to the finalization of and closing of this journey. I just want to tell you another thing, that I asked my doctor when can I start running, because I like to run, and he told me as soon as my foot starts to feel right, which is probably in a few more weeks. So I'm looking forward to that. But when we come to that point, and when I do start running, I will let you know. This is the week so and so after the surgery, I am finally done and I can run. And one more thing, the area between my two toes that where my neuroma was, that area is numb right now. And I'm not used to having that feeling of not actually having full feeling on any part of my body. So what happened is, when I immediately after the surgery, they put a gauze between those two toes, because the stitches go all the way in between the toes. So there was a gauze on the top of the stitches, and as the bandages were really tight, so they were all keeping my toes squeezed. And as I was going to the bathroom and coming from the hospital, coming home, and then going to the bathroom, and for those first couple of days before they loosened up my bandages, I actually had a blister between my toes caused by the gauze that was there. I will show you the area, it's actually visible, and I didn't know it. I don't feel it, it doesn't hurt, and that is a little unnerving feeling, that I have it's obviously a blister. It's obviously something that if it was anywhere else, I would know that I have it. And here, I only knew when I saw it. Once I went to the doctor and they changed the bandages, and I came home, so that was third day or fourth day, I was looking at my foot and I realized, wow, look how big blister I have here. And I didn't even know, because that area is numb. So I know the doctor said that some of the feeling will come back, but I don't know how much of the feeling. And I hope that it doesn't stay completely numb the way it is right now. Besides that, everything else is great. So until next time, and so long.